Welcome to our comprehensive guide on periodontal probes, essential tools in dental diagnostics. Periodontal probes are specialized instruments used by dental professionals to measure the depth and configuration of periodontal pockets. These measurements are crucial for diagnosing gum diseases and planning appropriate treatments. In this video, we'll explore the structure, types, and advancements in periodontal probes, ensuring you understand their significance in modern dentistry. Let's begin by understanding what a periodontal probe is and how it's typically used in clinical practice. A typical periodontal probe is a tapered, rod-like instrument with a blunt, rounded tip. It is calibrated in millimeters, allowing for precise measurement of pocket depths. The probe's design ensures gentle insertion into the gum pocket, minimizing tissue trauma. The shank of the probe should be aligned with the long axis of the tooth during use. This alignment is essential for accurate readings and patient comfort. The probe's markings and structure help clinicians assess the health of periodontal tissues efficiently. When measuring a periodontal pocket, the probe is gently inserted with firm, controlled pressure until it reaches the base of the pocket. Proper technique involves keeping the probe parallel to the long axis of the tooth. This ensures that the depth reading is accurate and consistent. In areas where the roots of teeth branch, known as furcation areas, a specialized curved and blunt probe called Naber's probe is preferred for better access and evaluation. Periodontal probes come in various types, mainly categorized as color-coded and non-color-coded probes. Color-coded probes have distinct markings that make it easier to read measurements quickly, while non-color-coded probes rely solely on engraved millimeter markings. The choice of probe often depends on clinician preference and the specific diagnostic requirements of the procedure. The Marquis probe is a popular color-coded periodontal probe with calibrations in 3 mm sections, making it easy to read during examinations. The University of North Carolina 1.5 or UNC 1.5 probe is another widely used instrument. It is 15 mm long and features millimeter markings at every millimeter, with color coding at 5 mm, 10 mm, and 15 mm. These features help clinicians perform detailed and accurate periodontal assessments. The Williams probe is unique in that it has markings at 1, 2, 3, 5, 7, 8, 9, and 10 mm, intentionally omitting 4 and 6 mm to reduce confusion. The Michigan O probe comes in two variants, one with Williams markings and another with markings at 3, 6, and 8 mm. These probes are designed for clarity and ease of use during periodontal examinations. The WHO probe is distinguished by a 0.5 mm ball at its tip, which helps prevent tissue injury during probing. It has millimeter markings at 3.5, 8.5, and 11.5 mm, with a color-coded band from 3.5 to 5.5 mm. This design is particularly useful for screening and monitoring periodontal health, as it allows for consistent and gentle measurements. The National Institute for Dental and Craniofacial Research, NIDCR, established criteria to address limitations of conventional probes. These criteria include improved precision, 0.1 mm, a standardized probing force, direct electronic readouts, and complete sterilization. Such advancements aim to enhance the reliability and safety of periodontal measurements. Periodontal probes have evolved through 5 generations, each introducing new features and technologies, from the basic manual probes of the first generation to the advanced, non-invasive, and 3-dimensional probes of the 5th generation. These tools reflect ongoing innovation in dental diagnostics. Let's explore each generation in detail. First-generation probes are the most commonly used in clinical practice. They do not control probing pressure and are not suitable for automatic data collection. Examples include the Williams probe, CPITN probes, University of Michigan O probes, UNC 1.5 probe, and Naber's probe. These instruments are valued for their simplicity and reliability in routine periodontal assessments. The Williams probe is a classic example of a first-generation probe. It features gradations at 1, 2, 3, 5, 7, 8, 9, and 10 millimeters, with the 4 and 6 millimeters markings intentionally omitted. This design improves visibility and reduces confusion when reading measurements, making it a favorite among dental professionals. The Community Periodontal Index of Treatment Need (CPITN) probes are designed for screening and monitoring periodontal health. They feature a 0.5 mm ball tip and specific markings for epidemiologic CPITN and clinical CPITN-C use. The CPITNE has markings at 3.5 mm and 5.5 mm, while the CPITNC adds 8.5 mm and 11.5 mm. These probes are essential for large-scale dental health surveys. Naber's probe is specifically designed for detecting furcation involvement, which refers to the area where tooth roots divide. It may be color-coded or non-color-coded, with markings at 3, 6, 9, and 12 millimeters. Its curved, blunt design allows for better access to complex root structures, making it invaluable in periodontal diagnostics. Second-generation probes introduce constant pressure control, improving the standardization of measurements. True pressure-sensitive TPS probes are a prime example, featuring a disposable probing head and a tip diameter of 0.5 millimeters. These probes apply a controlled pressure, typically 25 grams, ensuring consistency across examinations. Other examples include the Armitage and van der Velden probes. Third-generation probes are automated, featuring computer-assisted direct data capture. This technology reduces examiner bias and enhances the accuracy of periodontal measurements. Notable examples include the Foster-Miller probe, Florida probe, and Toronto automated probe. These devices often provide automated detection of anatomical landmarks such as the cemento-enamel junction, CEJ, and improve precision in probe angulation. Fourth-generation probes represent a leap forward with three-dimensional 3D capabilities. These probes are designed to record sequential probe positions along the gingival sulcus, providing a more comprehensive view of periodontal health. However, as of now, these advanced 3D probes are still under development and not widely available in clinical practice. Fifth-generation probes are designed to be both three-dimensional and non-invasive. They incorporate ultrasound or similar technologies to identify the attachment level without penetrating the sulcus. The only available fifth-generation probe is the ultrasonography US probe, which uses ultrasound waves to detect, image, and map periodontal structures, offering a non-invasive diagnostic alternative. When working with dental implants, it is crucial to use plastic probes instead of metal ones. Plastic probes prevent scarring and permanent damage to titanium and other implant abutment metals. Several companies manufacture plastic instruments and gold-coated curettes specifically for implant maintenance, ensuring both safety and effectiveness. Explorers are another class of diagnostic instruments used to locate subgingival deposits and check the smoothness of root surfaces after root planing. They come in various shapes and angles, each designed for specific clinical situations. Common types include the shepherd's hook, straight explorer, curved explorer, and pigtail or cowhorn explorer. Recent innovations in periodontal diagnostics include devices like Detectar, which uses a spectro-optical approach with a light-emitting diode and fiber optic technology to detect subgingival calculus. Perioscan employs ultrasonic acoustic principles to differentiate between calculus and healthy root surfaces. Keylaser 3 utilizes a 655 nanometers wavelength diode for calculus detection, showcasing the integration of advanced technology in dental diagnostics. In summary, periodontal probes have evolved significantly from simple manual instruments to advanced, automated, and non-invasive devices. Each generation has brought improvements in precision, safety, and diagnostic capability. As technology continues to advance, we can expect even more innovative tools to enhance periodontal care. Understanding the types and uses of these probes is essential for dental professionals committed to providing the best patient care.